Under 40, you'll now be offered an alternative to the AstraZeneca Covid vaccine. Why has the advice changed? UK regulators say this is a precautionary move, but it is because the jab is linked to rare blood clots. And now that Covid infection rates are falling, when weighing up the risks for younger people, because the chances of getting the virus and ending up in hospital is now lower, this has made the risk level similar to the risk of serious harm from side effects of the AstraZeneca vaccine, which is why alternatives will be offered. So are younger people more susceptible to blood clots from the vaccine?
The risks for the younger generation are actually slightly higher than older generations. Using some research carried out by the Winton Centre, they found that in the 60 to 69 age group, there were about 2 in every million people would suffer these serious blood clots if they'd taken the vaccine. Whereas those in the 20 to 29 age group, it was 11 in every million. So they're still really tiny risks. We're talking about 11 in a million versus 2 in a million, but it is still slightly higher in the younger age group.
Around 28.5 million doses of the AstraZeneca vaccine have been given in the UK, and out of those, there have been 242 reports of blood clots, and 49 of those have resulted in death. It's a particular type of brain blood clot called CVST that has been reported in many of the cases.
CVST stands for cerebral venous sinus thrombosis. So that's when a blood clot forms in the venous channels or the venous sinuses of the brain. So it blocks blood draining from the brain, and that sort of back pressure can cause blood vessels to leak and brain hemorrhage to occur.
Why does the AstraZeneca jab cause the blood clot?
Due to a really rare immune reaction. It's a unique syndrome, something we've never come across before. It's not typical of the usual blood clots that we're familiar with. The vaccine appears to trigger the production of a particular type of antibody called platelet factor 4 antibody, and this causes activation of the body's clotting system.
Are people who've had blood clots more at risk?
And it's not increased by people who have had prior blood clots or increased risk of blood clots, or for instance, those on the contraceptive pill. We're monitoring the cases and we're looking for common themes and risk factors, but as yet we haven't identified any.
What if you're under 40 and you've already had 1 dose of AstraZeneca? There have been 6 cases of blood clots reported after the 2nd dose of the vaccine, but this is the advice from UK regulators.
There are no safety concerns in relation to the 2nd dose of the AstraZeneca vaccine. So if you've had the 1st dose of the AstraZeneca vaccine and have had no problems from it, then please go ahead and have the 2nd dose of the AstraZeneca vaccine.
What are the risks versus the benefits? If you look at the data from last month, COVID infection rates are about 20 per 100,000. Looking at risks in the younger age groups, those in their 20s, if given the AstraZeneca jab, that would mean 1 admission to intensive care prevented, but it would also mean 1 serious side effect. For those in their 30s, it would mean preventing 3 admissions to intensive care, but also 1 serious side effect. If we go up in age groups, we find more admissions to hospital are prevented, which then changes the balance of risks. But for the vast majority of people, UK regulators say the benefits of the AstraZeneca vaccine continue to outweigh the risks.